Welcome back to Open Minded Healing. My guest, John Harvey, is a licensed professional counselor and is the founder and executive director of the Northwest Counseling and Wellness Center, which treats addictions, depression, anxiety, trauma, and other symptoms of mental suffering. John has been a proponent of holistic mental health care through the Northwest Counseling Center for over 25 years. He is also an advocate and practitioner of 5NP, which is the 5-needle ear acupuncture protocol, and is the topic of today's conversation. John is going to be discussing how this effective technique can benefit patients when it comes to their mental health. Welcome to the show, John.
Glad to be here. Thank you for the invite.
I know you're trained in and you combine a variety of therapies such as hypnotherapy, EMDR, auricular acupuncture for addictions, and mindful practices. And I'm really happy to see that the treatment of mental health conditions has expanded beyond medication and talk therapy alone, and is putting more power into the client's hands when it comes to their recovery. Before we get into the specifics of 5NP, I want to know when you decided to combine the traditional Western psychotherapy practices with the more mindful Eastern practices. Were you seeing a void in mental health care, or were you just always interested in both practices from the start?
Oh, that's a great question. And I think I've always been curious about a lot of different ways that people can heal. And so back 30 years ago or so, I was really intrigued with Milton Erickson and the use of hypnosis as a way to help people to find their story and then build on that. So it was a very inside out approach, and what I think evolved into more, narrative therapy ideas. So from my own experience of how to manage my own stress and cope with my own stuff, I have been a meditator for many years. And a colleague turned me on to this tool. He had been trained and said, do you want to try AccuDetox? We were working in a treatment center at the time, and he explained to me a little bit about it. And I thought, this is kind of crazy, but yeah, I'll give it a go. And it was my experience with that very first treatment that led me to believe that there's something to this. This could be really good stuff. And you don't need to have any prerequisite skill. It's a nonverbal treatment, and that would just fit very easily into my practice.
So when you talk about AccuDetox, you're talking about acupuncture, detoxing the body through acupuncture?
That's one of the names of this 5NP protocol. And it had been used and developed specifically for addiction treatment since the mid-1970s. In Texas, it has been legal to use this tool in the state for certain healthcare providers who are non-acupuncturists could be trained and use it in the addiction setting. So AccuDetox is the old name. We're trying to rebrand it because it's way more than just drug detoxification. Although it does do that, but its biggest feature, in my opinion, it just helps people to slow down and kind of get out of their own way, and it creates space for people to engage in some other ideas. So we're really fond of this tool. We've been using it since 1997 in our practice.
That's really interesting. A couple of things come to mind. One is that you are using it for addiction. So it actually detoxes the drugs out of their body. Is that what you're saying? Or that shifts some energy? How is that working for addiction?
Well, the bigger picture of Chinese medicine is it promotes balance and flow of our life force that is sometimes called qi. And a lot of us in our culture have the scattered qi condition. Our energy is all over the place. We're spinning a lot of plates. We're anxious and afraid, and it kind of helps to gather that and ground people. So in Chinese medicine terms, it's a yin treatment. It's of the earth. Helps people to find some solid footing, feel stable. But the big picture of this protocol is balance and flow. So it does that with the filter organs. It kind of moves material through toxins, through the lung, through the kidney, through the liver. Those are three of the points that we do. And then there's some other points that are in there around physical and emotional calming. So that's the 5-point protocol, now known better as 5NP.
So the other thing you mentioned was it is calming to people, and that's good in a therapeutic setting or counseling setting. And it makes me think of people that go into a hospital, say they have a mental health emergency, or they end up in a psychiatric ward. And I've heard so many stories of how they treat those people that come in where they're surrounded by so much chaos and noise. And so I'm thinking this would be such a great technique. It sounds like for someone that is first entering the hospital with a mental health condition.
That's exactly right. It has been used and developed at a hospital in the Bronx, Lincoln Hospital, and they would just offer it freely. They would invite people to come in and try it. And they did try it, and they were able to calm down, and it worked to engage people safely. And that's a very subtle thing that it does, because early recovery is a frightening endeavor. You fear going through detox, and you ask yourself a lot of questions. What am I going to be like when I grow up and, clean and sober? Will the world like me? Will I like me? All kinds of fears associated with letting go of addiction. And this kind of cuts through a lot of that, just tends to calm people down. And so it works for acute detox in that setting and what's called post-acute withdrawal syndrome, which is kind of this lingering effect that's exacerbated by stress and kind of lingering withdrawal symptoms. So it just kind of paces people kind of where they're at and allows them just the luxury of a little bit of peace and calm that they can take credit for. And there's nothing in the needles. There's no drug in the needles. So they can be assured that whatever good thing is happening is a result of their innate healing potential. So we like to remind people of that a lot too. And that's empowering and hopeful.
Yeah, that would be empowering. And to know there's nothing in those needles. Let's get into the specifics of 5NP so people can visualize this. So it is an acupuncture technique, right? And it's 5 needles. We're not talking about big needles. We're talking about the acupuncture needles that are, they're small.
Yeah.
And where are you placing them? They're all going in someone's ear, right? Can you get into detail about that?
Yeah. So acupuncture needles are not hollow. They're not hollow bore, so they're not going to hold any blood. So it's a pretty safe procedure. That's why the state medical board has allowed us Texans who are not physicians or acupuncturists to do this procedure. So it is a ear acupuncture procedure, but we're careful not to claim that we're acupuncturists. We're not. We are mental health care professionals that are trained to do this 5-point protocol, and that's it with needles. So the needles that we use are prepackaged sterile. They come 5 to a pack for this procedure. Amongst the acupuncture community, it's pretty widely known, this 5NP protocol. Some acupuncturists just will do it without knowing any other symptoms to treat, just because it tends to relax people. But the 5 points that we do, the first point is called the sympathetic point. And I guess I could back up a little bit. The ear is a map of the body. That is a reflexology, basically. There's a little human being in the shape of our ear that looks like an inverted fetus. In here, in the shell here, are the, liver, kidney, lung that we do. So the ear lays out that way, and that's based on research from the 1950s. Neurobiologists have figured out that there's a connection between this point and the liver and this point and the kidney, and it's mapped out. So there are many, many active points in the ear. But the first point that we do is called the sympathetic, and it's in the ridge of the ear, and it's a hidden point. So you don't see the tip of the needle. But that point, the sympathetic, will sometimes produce some immediate calm in a person. It's usually the antidote to fight and flight. Fight and flight is, busy, scared, lots of chi everywhere. This gathers chi, helps people just to calm down. It's more about rest and digest. That's the first point we do. The second point is a point that's close to it that's called Shen Men. Shen Men means spirit gate. So it's a good point for emotional kind of letting go. It's a good point for anxiety. It's a good point for stress. It's a good point for trauma, PTSD. So that kind of emotional stress that people have, it's about emotional kind of mediation and calming. Those 2 points first. And sometimes folks will have just this kind of immediate feeling like the air is kind of going out. Just drop their shoulders. It gets quiet. When we do a group, the group gets quiet. So those are the first 2 points about taking care of some fight or flight for us physically. And then the second is emotionally. Then the other points that we do would be arranged like the map of the ear, kidney, liver, and lung. And those 3 points together help qi, energy, to move and to balance. In Chinese medicine, there's a lot associated with those 3 points too. Chinese medicine gets a little complicated, but there are some emotions that are kind of connected to those last 3 points. Kidney is a lot about fear, and then the opposite of that being courage. There's some anger that's associated with the liver, and the opposite of that is kind of justice and resolve. And there is some sadness associated with the lung point, but also some pride, some gratitude. So joy and sorrow, anger and justice, fear and courage are kind of the balancing point. For those reasons, I think that this tool tends to meet people where they are and help people to balance regardless of what their particular issue is. So a group of 10 people can have the same treatment and 10 different responses. But most commonly what happens is that people just kind of relaxed. Sometimes people fall asleep.
Yeah, the way that I met you was at the biohacking conference that my sister and I went to, and we went and got the free treatment to try it out. And we loved it. And so we went back the next day and got another treatment because it was so relaxing. It put you in like a meditative state, and pretty quickly too. So we felt the effects of it. I'm curious, if you put a needle in the part of the ear that refers to the liver and they have an anger issue, is it more uncomfortable when you put that needle in? Do they feel a difference in the areas that are really unbalanced?
Yeah, it's hard to really kind of interpret what is happening there. But sometimes, if a point is a little tender or even a little like a pinch or a little bit of a hurt, I think that's significant. I think that that's how our body tells us that there's something going on there. So I don't want to get way ahead of things and interpret or overthink what's going on with the client. But as a therapist, I might kind of put that in my back pocket. I might even encourage a client to pay attention and to wonder about what's going on with that point too. And if we're lucky, then we can maybe process some things of meaning in a therapy session.
Yeah, that's good if it gives you, even if it's a small indicator, but gives you a little direction of where you might start with the client.
Right.
And they may know exactly what it refers to. If you tell them, the liver, and they know it's associated with anger, they might know what they're feeling.
And sometimes they don't really kind of make that connection until afterwards. So our instruction as we're doing this is we say, sit with dignity and cultivate a witness self or something like that. We have people just curiously notice what's going on. And most notably, people can feel relaxation in a number of ways, feel a manifestation of movement of qi. Sometimes it's warmth. Sometimes it's gravity. Sometimes people feel floaty. So there's a lot of subjective experience in this, but mostly the procedure sells itself. I can talk about it for a long time, but it's the experience that people have with it that lead them to say, there's something about this that seems to work for me. So we like to get people curious.
I think it's great that you do go to things like those conferences and let people actually experience it, because that is a selling point for sure. Like I said, my sister and I went for a second time because it sold us on it. So who is using this protocol? What types of practitioners and what are they addressing with it?
Right. So September 1st of this year marked the 1 year anniversary of our changing the law. And the law allows for practitioners to treat not just addictions anymore, but conditions of physical, emotional, psychological stress and trauma. So that's a lot of territory. That's about everything in the DSM.
What's the DSM?
The Diagnostic Statistical Manual of Mental Disorders. It's put out by the American Psychiatric Association. And so it used to be that we would need to justify, if we're using this treatment, we need to justify that this person has a substance use disorder diagnosis. Now we don't have to do that. Now we can do this treatment regardless, without a diagnosis, really. Without having an informed diagnosis, we can use this treatment protocol to help calm people down. And, mostly in our setting, we will do a psychosocial workup with people. We want to find out what's going on with them before we do the treatment. But we wouldn't have to use this tool. So we can go to workshops and we can go to conferences and we can demo this to our heart's delight without having to worry about making a diagnosis. So that's how the law has changed in Texas. It's not that way for every state, unfortunately. But the VA has really helped us out a lot. And the VA is using acupuncture, this protocol and other protocols to help vets with PTSD and pain and anxiety and addictions and all the things that we do as well. So because that's really nationwide, this is starting to catch on, and legislators are realizing, well, you know what? The general public should have the same kind of availability for this tool as the vets do. So we were able to do that in Texas.
That's awesome. I hope they are going state to state, and especially as you put this out there more and educate people about it. If people have a great desire, then they'll push the laws in their state to incorporate this. So it's easy for everyone to get it. It's such a simple little procedure. And I've had acupuncture before, so I've had the needles all over the body, and there's some points that I'm like, I get nervous about. But this one in the ear was so easy and so relaxing that I could see doing it all the time. So speaking of, I guess, how often you have it done, how long does the effect last? Is it just while the needles are in the ear? Does it continue after that for a little while?
Yeah, it continues afterwards. A good example of that is that we have people come back and say, wow, I slept great last night. I wonder if it was because of the acupuncture earlier in the day. And of course, one of its benefits is to help with insomnia. So yes. So we encourage people to continue to pay attention well after they've been treated. And it lasts for a while, I guess longer in some people. We also can use beads and seeds. And those are just little, sometimes metallic, sometimes kind of a living seed that you can tape on a point. And so you can wear acupuncture, basically, acupressure in this case, out of the building. And then if you encounter an anxious moment or whatever, you can touch the bead or massage it a little bit into the point, and it works. It's way more subtle than needles, but there are ways to kind of expand, I think, the therapeutic benefit of this. So in our clinic, we do it a couple times a week, Tuesdays and Thursdays, and we open it up to the public and have folks give us a call and reserve a spot to come in. And I'm likely to use this with a lot of my clients during the course of a session somewhere in there.
So what have you seen in your practice specifically as far as the way it benefited clients in your office?
Sometimes there's this immediate impact that it has on people. For a person that's never really meditated before or doesn't know how to sit still or they're just kind of agitated, to have that experience slow them down to a point where they feel still and at peace. So sometimes it's huge in that way. But I think more commonly, it just has this subtle impact that people who do it time and again will sometime down the road realize I'm just more calm about things in my kind of general life. And I attribute that to 5NP. And so that's exactly how we want people to think about it. It's just kind of subtle. And someday you'll have an epiphany and you'll wonder, wow, is that about acupuncture? That's a yin flavored treatment right there. It's just kind of low and it's slow and it's subtle. So now that we're talking about yin and yang, yin literally means the shady side of the hill. So it's the other side of the hill that you don't see. There's a bit of a mystery to it. Things on the shady side they maybe grow closer to the earth. They may be cooler. They may be more damp. Those are yin features. But I like the mystery of yin. And we're going to encourage people to be curious and continue to pay attention. And then maybe down the road, they will notice something. We do a lot of our acupuncture in a group setting. If somebody has an experience outside of the group setting, then we'll want for them to come back and share it if it has meaning. And that's a way to kind of document an experience of a person too. It's not just what happens during that 45 minutes that you're with us doing this. It's stuff that happens outside of that frame, maybe the next day or 2 or 3. So over the course of my experience providing this treatment, we've had some really great stories about how it's helped people.
What are some examples of that?
Oh, I just remember, he was an older man who was grieving the loss of his wife. And he was really kind of stuck on that. He'd been married for a long time and was really in a lot of grief and loss. And he would come pretty regularly for acupuncture, and the community and his ability just to kind of be calm, helped him not to be so attached to the grief. I think it kind of acts in a way like EMDR is supposed to. If you're familiar with that tool, it helps people loosen their grip on unpleasant memories. Doesn't eliminate that. It's still there, but people are more able to hold it loosely. So I remember this guy for saying, I'm so glad that I've come here. I really think it's helped me to manage my grief. It's not so intense for me,
Yeah.
There could have been other factors too, like he had a community of support and, a lot of other things, but he was able to kind of get out of his head. And this is true for me, that sometimes when I'm doing the treatment or having it done to me, I feel like my head is empty, like I can't hold a thought. Now, I know that's not true, but it just feels like there's a whole lot less clutter in my head spinning around. And for me, that's pretty blissful. So I've heard people say that an awful lot.
So is this cumulative? The more you do it, the more impact it has over time?
It seems to be. Part of that is probably just training your mind, body, what to expect, and to be on the lookout for kind of common evidence. Sometimes in our practice, we talk about evidence-based practice, not practice-based evidence, You do the procedure, it informs you, and it makes sense to you. And your mind body begins to anticipate it. And it's kind of a wonderful thing when that happens. So people learn, here's what I can expect. Some effects are a little bit more startled than that. Sometimes people it just seems to free people up and they can emote. So you might have people who are crying in group. That's a rare occasion, but people feel safe doing it. Seems to kind of free people up. And there is that kind of mystery about it that I like personally. Yeah.
Yeah, it reminds me of meditation because I meditate as well. And if you do it every day consistently, you don't maybe the first time have this big response, but over time, I would see myself in different situations and I found myself responding differently. And so I think it is a cumulative thing. It sounds like meditation is, and where it just calms your nervous system and it's creating in your mind, I guess, a new neural pathway. It's learning to expect something different. And so over time, you keep repeating it and it creates that different pathway maybe.
Yeah, I mean, I think that's true. What we know about, elasticity in the brain and how the brain does that. So it's another response to stress and anxiety. So people can get to a point where they just imagine that needles are in their ears and they can calm themselves down because they know of that experience. They know of their capability to get there. So the needles do work because they attract energy, they attract it and they balance it.
Well, I have had acupuncture, as I mentioned, but the first time I ever had it, I had a real experience of feeling the energy shift where my body got really hot and then it got really cold and my teeth started chattering. And I was kind of freaked out by it. And she said, no, there was a block there and the energy is moving now. And I could physically feel that. So I knew the power of it from that experience, even though after that, it wasn't as strong of a indicator that something was going on, but it still helped the reason why I first went in there.
Yeah. Yeah. And biohackers do that in a technology that is very, very modern. This is ancient technology, but it does a lot of the same things as the new technology. It kind of moves energy around and it creates shifts into more healthy kind of patterns. The difference is like thousands and thousands of dollars. The package of needles costs order.
Yeah, a little more affordable.
Yeah.
Well, so who could learn this technique if there are people out there that are interested in learning it so they can share it with their clients? Who's allowed to, who's allowed in Texas to learn this?
In Texas, my colleague Martha Marshall and I advocated for the change in law, not just for who can it treat, but who can be trained to treat. And so licensed professional counselors, licensed professional counselor associates, social workers of all stripes, physician's assistants, RNs, LCDCs, which in the state of Texas are licensed chemical dependency counselors, MDs. There's a list of others that we want to add to that list. Like, there's life coaches. We think maybe someday yoga instructors could use this tool. So that's quite a lot.
Yeah. And that does seem like something that everyone could use. So maybe even, I wonder if massage therapists or physical therapists there probably is such a range of people.
And chiropractors, there's a lot of, EMDR first responders. I mean, we just keep kind of thinking of who else could be added to this list. So
that's a good one. First responders. That's a good one.
Absolutely. In the state of Colorado, there's not a lot of regulation. Anybody who's professional can be trained. So it's like wide open in Colorado. And we like the idea that in Texas, people be licensed healthcare providers. But in Colorado, that's another way to think about it. What if moms and dads could use this tool on their kids? Just the potential, this good tool to be used in a beneficial way is huge.
So are there any contraindications? I'm guessing not, but I don't know. Are there?
Well, no, not really. If you get needled frequently, you can have a hematoma, bruise in your ear. We would lay off that point. There could be some, eczema, some kind of skin condition that we wouldn't want a needle on. But no, the 5 points are safe for people. There's no contraindication. Sometimes people might experience a little vagus nerve reaction, needle shock. We'll know that pretty much right away if we're needling somebody and they feel a little woozy, and we'll take needles out, and that's that. I mean, that doesn't stick with people. And those people can come back another time and do it. Otherwise, no, it's very safe to use. That's why the state medical board in Texas has allowed us non-medical professionals to do it. And of course, part of our training includes clean needle technique, universal precautions. And we want to make sure that people are taking this seriously because there is blood that sometimes happens in a treatment experience, but that's usually something that a Q-tip and a little pressure can take care of. But we do have to be very careful. We don't want to have any needle sticks or any of that kind of thing, even though there is no evidence that an acupuncture needle has ever transmitted a bloodborne disease. But we're very careful, nevertheless.
So how long have you been training people to do this technique?
I have since 2001 been training people. So a while. Geez, a long while.
And where do you go other than the biohacking conference? What other places? Do you have any coming up, places you're going to be, events?
Oh, now that the law's changed, we've done a training in Arlington, Texas, and we have one to look forward to in Galveston. And we're talking to the Menninger Clinic in Houston about a training there. So there's some opportunities unfolding. There's a biohacker presence here in Austin that we want to. In fact, the conference is going to be in Austin next year. So if you come next year, I'll see you. And there have been a lot of local opportunities for us to go in and demo the tool. There's a growing grassroots movement here in Texas, it feels like. So we've done a lot of trainings over the last year. We're looking for funding. We're looking to train more trainers so that we can kind of get out. The state of Texas, there's a lot of underserved populations in Texas. And this tool, instead of waiting for 4 months to see a psychiatrist or something, this tool could be a kind of a stopgap. So we're interested in training the different regions in Texas that are supposed to provide mental health services to all citizens. We're looking to expand in that direction. We got quite an ambitious list of agencies and organizations and people that we think should know this tool.
I'm wondering now about prisons. If you could calm the vibe in the prison system, if you could do that for both inmates and the workers that work in a prison.
I'm glad you mentioned that. And that has been a thing in Austin, Texas, the drug courts, and providing that very service in prisons and institutions and jails. And I really like your point that workers too can get burnt out and stressed out and experience compassion fatigue. And so it's good for administrators and workers to try this tool out from time to time too, or more regularly kind of address their self-care. So yeah, both sides, there's a lot of opportunity to treat people.
I was also thinking about the hospitals, because I know my sister has helped people. She's a nurse, but she's a nurse educator as well. And she has helped people in the past, what do you call it? Like set up space for the other nurses or doctors to come in and find ways to sort of relieve the tension, whether it's through hand massage or different ways. So I think that'd be awesome for them as well. So do you have a particular mission, would you say, when it comes to promoting mental health in this way, as well as the other holistic ways you address mental health?
Yeah, I'm pretty passionate about doing things holistically. And that doesn't mean no more Western medicine. It doesn't mean anything like that. Sometimes medication is helpful and necessary. Sometimes surgical procedures are important. My son and his severed Achilles tendon. Meditation is not going to fix that. He really needed and was helped greatly by Western medicine, being able to stitch things together for him. And what's better than new? So Western science is really important in helping the physical human machinery when it breaks down. But it's not very good at helping people to figure out how their mind works. So this is a tool that helps people to be curious and to have a conversation about why they think the way they think, and to kind of relax and hold things loosely. And it's not going to take their symptoms away so much, but sometimes people can figure out how they can manage their symptoms better and live a full life without having to rely on medications that are there just to address the symptoms. I really like the idea of cooperative medicine, the patient and the physician or the healer together having a conversation. And it's not just, you do this for me, you give me this pill or my medication or whatever, but it's more of a relational transaction that people have. So there's I've got 15 minutes to figure you out and give you a chemical that I think might help you. And then I'll invite you back, in another 6 weeks and we'll see how that went. So it's geared towards the Western medical approach, which is let's fix your brain chemistry with this medication. Let's take care of that symptom. I think life is complicated, and I think that having some insight and some understanding and some trust in our own innate healing potential is so important. And that, along with a physician, is a good combination, you know? So I'm pretty passionate about folks also tapping into innate healing potential. I think that we're born with the capacity to heal and we lose it over time. Psychotherapy is literally kind of healing the broken psyche. It's helping to rebirth what is already there.
Yeah.
And this acupuncture tool is kind of a nifty way to do that. It's subtle, but what people learn from it is that maybe I'm better than I thought I was.
Mm.
You know, I feel better. There's no drugs in the needle. I didn't say anything. I wasn't asked to do any checklists or anything like that. It's very subtle. It's very inside out, and it's very empowering. And I love that. So that, in conjunction with about any other kind of healing modality, I think is really powerful.
Okay. Do you want to go ahead and tell people how they can find you?
Now, people can get in touch with us. Our organization is 5nptexas.com. That'll take you to our website. We have some information there. If you want to get trained, there's registration forms there. We want to build this website up as a kind of a warehouse for a lot of information, a variety of different things. So they can go there. They could email myself, John Harvey, at john@5nptexas.com. I'll be glad to talk to anybody anytime about this tool.
Yeah, that's perfect. Well, thank you for coming on here and explaining this technique. It's something I can back with my own personal experience that it's a great tool. It definitely calms you. Everyone in that room in our group was in that same meditative state, so we all felt it. So thank you for sharing something that can be beneficial for everyone's mental health.
Well, thank you for inviting me, Marla. I appreciate it and hope to see you down the road, maybe at the Austin Biohackers, or if you're ever in Texas, Austin, Texas, a good place to visit.
Yeah, that's one I haven't been to yet, Austin, Texas. So I'll look you up if I come through.
Okay. Well, thanks very much.
Be sure and follow Open Minded Healing so you'll get every new episode as soon as it's released each Tuesday. You can listen on Apple Podcasts, Spotify, and wherever you get your podcasts.